Hello everyone, and thank you so much for being here today. I'm incredibly excited to welcome you to this important conversation at the intersection of mental health and heart health, two areas that are often treated separately but are deeply connected in more ways than most people realize. Here we're honored to have Dr. Ameeth Vedre with us, a leading cardiologist who's not only deeply skilled in treating heart conditions, but also passionate about understanding how emotional and mental health can directly affect the cardiovascular system. Today, he'll be sharing insights and answering your questions based on real-world patient care and latest clinical evidence. Now, before we jump into your conclusions, I'd love to ask Dr. Vidre to give us a quick interview overview. So, introduce yourself, Dr. Vidre. Tell us more about yourself.
Great. Thank you, Nitin. Great effort. I'm a uh, non-invasive cardiologist, general cardiologist, and the views I'm going to express are solely mine and based on the current evidence of American College of Cardiology and not necessarily associated with the workplace I am associated. And but having said that, I've been a cardiologist since 2011, and I've been a physician since 2006, practicing MD. And I've got training from Michigan State, background at University of Michigan, and went to attend some advanced cardiac imaging at Duke. Having said that, I'm happy to answer among many perspectives. The ongoing series, the effort with Nitin Mali, and this is good. Kudos to you, and happy to answer some questions in the brief time we have.
All right. Without further ado, let's begin. Let's see, the first question that I wanted to ask you, Dr. Vidre, was how does stress in everyday life affect heart health over time?
So, Nitin, that's a very broad, comprehensive question. Yes, stress certainly affects cardiovascular health in general in varied aspects. A, it can affect blood pressure, heart rate, and continue to perhaps influence other behaviors such as difficulty in sleep, perhaps in some individuals lead to alcoholism. All of this can bring in multiple facets of worsening of cardiovascular health, of blood pressure, and subsequently that can lead to heart failure.
That's a very comprehensive response, Dr. Vidre. I'm a little bit curious because I got a question about this on my TikTok the other day.
Sure.
What's the difference between like your increase in heart rate that is caused by exercise and stress?
Mhm.
Since somebody wanted to know like the difference between why one is good and why one is bad.
Yeah, it's definitely a two-pronged question. The heart rate increase, which stress can have, probably is emanating from a long standing associated effects of blood pressure and subsequently lack of sleep and all of that. On a long term basis, it could be a week, 2 week, and perhaps months, that can lead to irregular heart rates and reduction in function of the heart. Now, the second question, what you said is, what is the uh, probable effects of heart rate with anxiety or exercise. Now, exercise heart rate is different. In the scenario, you are having conditioning and it's a short term, and the response for that is you are awaiting a significant metabolism associated increase in heart rate. So, that is a totally different facet, if you will, from a stress induced, and perhaps there is something else which needs to be discovered. So, stress induced cardiovascular abnormal hemodynamics, by that I mean, to kind of dumb it down, hemodynamics means abnormal function, such as blood pressure. And I keep bringing blood pressure because on a daily basis, it's very common. Stress induced blood pressure, not necessarily heart rate. Blood pressure is significantly abnormal, abnormal cortisol levels, abnormal hormones, and abnormal behavior associated with it, all of that come together and cause significant cardiovascular abnormal outcomes.
All right. So you're saying that when it comes to exercise, it's sort of just like conditioning, but stress sort of causes that increased blood pressure that sort of like thins out the arteries and blood vessels.
Mm. A little bit similar to that. It takes a little bit more comprehensive discussion to that. But yes, on a longer trend, stress causes significant abnormal effects. Exercise induced cardiovascular effects are generally good.
All right. So I'm curious next, what's the correlation and why between anxiety or depression and heart disease, especially depression?
Mm. Great question, Nitin. A lot of even New England Journal of Medicine articles, American College of Cardiology articles have recently come across shown for association of depression and cardiovascular abnormal outcomes. By that, what I mean is significant disparities in sleep, uh, the circadian rhythms, and association with abnormal rhythm of the heart. And if you will, the heart has yin and yang, sympathetic and parasympathetic nervous systems, which are significantly affected by day to day activities, if you will. So, sympathetic activities are a fight and flight response. Parasympathetic usually reduces the heart rate. So, the short answer to your question is we do have abnormal effects on a long term for depression, which can lead to even effects on blood pressure, subsequently affecting cardiovascular health. And all of these are long term, not short term. It has to go on for a long time, and they induce other behaviors, right? Sometimes their diet is affected. Sometimes they are unable to take any other medications. So it's a conglomerative, comprehensive. It's not a direct. It takes in a multitude of effects to bring in an abnormal effect.
So you're saying sort of the things that depression and anxiety cause are
Mm,
the big thing, and the actual direct effect is only like a smaller aspect of it.
that's right.
All right. Sounds good. And now I'm curious, how does social isolation or feeling lonely increase chances of having heart disease?
Mm. Social isolation and what was the first one? Depression, you said? The
Loneliness
question?
and social isolation.
Loneliness. So, overall, it's mental health. Mental health is a growing, and perhaps among all of us, in fact, we tend to oversee it. Mental health, stress, these are hidden risk factors. They perhaps bring in an uh, association of uh, other side effects, such as inability to take medications, inability to sleep, inability to take proper nutrition. All of that brings a effect. So, like I said, it's not a direct causality, but it has a indirect effect, which is subsequently creating havoc in your hormonal, endohormonal homeostasis milieu, and it brings in ultimately effects on blood pressure. And that ultimately, along with perhaps change in circadian rhythms, abnormal rhythms of the heart, can induce abnormal cardiovascular effects. And I brought in a topic in the early beginning that sometimes patients maybe increase cigarette smoking, maybe increase alcoholism, maybe all of that can cause abnormal cardiovascular effects, well known as we know. So it induces and brings in abnormal effects, if you will.
All right. And now I'm curious on the topic of emotional stress and loneliness and social isolation. What are some early warning signs that emotional stress is starting to hurt your heart?
Mm. Palpitations, significant amount of palpitations, inability to sleep, um, abnormal blood pressures, headache, um, perhaps chest pain, very rare, but a condition called coronary spasm, microvascular angina. What these words mean is angina, which is difficulty in chest pain, medical term for that. All of that can be direct correlations.
And now I'm curious when it comes to the patients
Hmm.
and mental health support. Do you see any patients whose heart problems and heart disease improve after getting mental health support?
100%. Um, Starting from the acute mental health units, very rarely in the hospitals where we're called in as cardiovascular providers to help associate um, proper side effects counseling of medications to direct home or outpatient visits. Mental health leads to abnormal behaviors, and you need supervision. You need uh, all the support you can, and improvements in mental health support, social support, recognition of it helps and lead to proper behavior in taking care of oneself, appreciating the social support and taking care of medications on time so that the blood pressures, um, medications, their general milieu. Say for example, if the patient is having mental issues and is not able to take care of regular medications, um, improvement of that takes good effect on proper nutrition, taking care of their medications, thus improves their health. So it's a direct correlation.
Hmm. That sounds good. And now let's see. Do you have any stories by chance of patients and mental health support that have helped improve heart disease?
Well, certainly, anecdote situations. Um, uh, uh, an elderly um, um, uh, male who had, say, Parkinson's and who had depression. Um, always had low blood pressure. Is there are certain medications that they take causes blood pressure reduction, but at the same time, um, they're having Parkinson's issues and neurological issues and depression. So proper counseling, home care therapy lead to appreciation of side effects, understanding that drug interactions. So those that comes to my mind. Many young patients who have scenarios where they have ability or need for taking medications on a daily basis for increased focus, depression, anxiety, and they have side effects. It has to be cared for on a daily routine regular basis, 6 months an year, looking at the ekgs, the safety of it, and attempting to oversee with a monitor and observe for any abnormal rhythms, education of when and with the safety of it. So we've seen on a daily basis patients improve and safely guide their therapy along with the psychiatry team as well, outpatient basis.
That's very interesting. And I know how you mentioned the medications, that people will use medications for mental health, and that might be helpful for their own heart health. But I'm
Mhm.
curious, when it comes to natural activities, are there specific natural activities like meditation,
Mm.
journaling, etc., that help both heart and mental health?
I strongly believe that. I strongly believe that yoga, meditation, and taking time for oneself in the daily routine, let it be um, in between education for young folks or regular exercise, exercise regimens, instituting on a daily basis, anything, as long as you take time for yourself, take care of oneself. Say a Take for example a busy individual. If you're able to break the routine, give 5-10 minutes for yourself, shut down your devices, shut down your say TV, for example, spend time with family, take breaks during work. It's a cumulative effect. So, on a daily basis, there are multiple scenarios which you can institute to regulate your blood pressure, the breathing techniques. There are multiple advanced mechanisms dating back to non-allopathic, scenarios. Let it be yoga, meditation, what have you. Utilize them and seek help. The most important thing is recognition, discussion, and this day and age, we can prevent, delay, identify any effect of cardiovascular health. And so, yes, the answer is it has uh, great effects in reduction.
All right. And I'm curious, what do you specifically do for your own like mental health habits?
Yeah, thank you. I take time, like I said, I take time during our busy schedules to gain composure. Um, I do close my eyes at least for a couple of minutes to 5 minutes, spend time for myself, walk about, and that's during the daily. I do utilize a significant portion of weekends in spending time with family. I truly believe, you should take time to explore oneself. Apart from regular conditioning exercises, 20 minutes, all the regular scenarios, proper nutrition, reduce high glycemic foods, hydration, reduction of stimulative agents, absolutely no alcohol, as much as less, things like that.
Yeah, I think one of the other cardiologists I interviewed, he said he doesn't drink at all. So
That's
yeah,
good. That's good. Yeah. Um, you know, uh, water hydration. See, it's a social lifestyle structure. If yeah, even if you do regular um, social drinks, but hydrate a lot in before and after. Hydration is the key. Water, water hydration. I mean. Hmm.
all right. And now I'm also curious, how important is emotional well-being after a heart attack or major heart event? Because I know
Mm,
it's helpful preventatively, but I'm
mm,
curious, what about it post
mm.
like heart attack?
It is significantly because we need the patient to take his or her medications. If they don't take it on time, it can cause havoc, can cause complications. The patient's homeostasis, milieu, emotional structure, all of that has to be really discussed, seen closely. If they need help in emotional, that needs to be given through family support if they have, or at least discuss with provider. Education. It's very common to have depression because why me? Why me? I've been taking care of myself. I still have disease. So emotional understanding, validation, constant discussion, education, assurance, and just being there, listening to them and coaching through them is the best way. Yeah, because we do see blood pressure issues, heart rate issues, abnormal side effects if they have emotional issues, especially, and all of these are very common after a significant cardiovascular event.
Yeah, especially with blood pressure, your heart already had to deal with that sort of bad event. Like imagine how bad it's with another event like that.
Sure, sure.
And now I'm curious about like endorphins and how they're them in heart health.
Mm. Endorphins are, for lack of words, magic substances, antioxidants. You know, uh, the human pathophysiology, biomedical milieu has this endorphins, which supposedly can improve oxidation, improvement of mitochondrial function, improvement of, in general, cellular function, which on a cumulative basis, improves dramatic responses after injury, necrosis, prevention. So endorphins are a not necessarily cardiovascular, cellular auto mechanisms, and which through which the body heals itself or helps uh, prevent or work through injury, inflammation. So the natural ways to improve that is proper nutrition, um, proper mental health, uh, conditioning, proper diet, hydration, good fruits, yeah, that kind of scenario.
All right. And that's good. That sounds really interesting. And now I'm also curious on the subject of emotional stress
Hmm.
and that affects endorphins and heart issues. Like, what do you give patients who are dealing with emotional stress who you see on a daily basis or consistent
Mm.
basis?
So, Nitin, this is a very comprehensive topic, but on a short answer to that would be evaluating what is the roadblocks in health. If it's emotional health, try to give them help through proper resources, identify that. So when you see a patient, we try to understand what else are these scenarios. We just don't write prescriptions and they take these prescriptions. We try to identify, work through primary care, give them scenarios. Is it the home health? Is it nutritional? Is it an cardiovascular, endocrine, or is it anything else to improve the emotional milieu? So all of these, like I said in the initial part, they come together in improving the cardiovascular scenario. But the short answer to you is yes, we do see good responses when we kind of think through and identify, and just talking and identifying with the patient what are the main needs for them, roadblocks, and opening up a conversation. Are you taking your medicines? What time are you taking it? Are you compliant with your medications? Are you, if you miss, why do you miss? What can we do to improve? What are the side effects? Bringing them back, having a conversation, things like that.
All right. So it's sort of you have to connect to them on your own
Yep.
and you have to
Yeah.
sort of like then like work through it and figure out like the main cause and how we can
Hmm.
prevent that cause.
Yep.
All right. And now a final note. To ask this
Hmm.
to the other cardiologists I interviewed. What's one
Hmm.
thing you wish more people understood about how the mind and heart are connected?
Hmm. It's a direct correlation, primarily based on the ability to recognize that there is a problem, educate oneself for to know that ability to take and go seek help. And once you have some cardiovascular abnormalities, even to continue on medications. So you have to have the good normal mental maturity and or seek help. It's not wrong. It's not, don't feel shy, and ask for help. And if your friends, family recognize that, help them, be there for one another. So recognition is the key.
All right. And is that all you'd like to say?
That's right.
All right. And so thank you so much, Dr. Vedre, for shedding light on this kind of a topic, which is like super like overlooked, especially as mental health gets more and more important at times. And I like how you talked about impacts of stress on blood pressure to emotional well-being and personal habits. And so I think it's really important that we care for our own mental health since that's sort of becoming more and more important in heart health. And in general, I think it's important for everybody to reach out and make sure to take care of their own mental health since it might actually end up impacting how somebody's heart functions on a daily basis. So that's all.
Nitin, great effort. I applaud you. And I think this is wonderful putting together of important scenarios. Happy to help. And recognition, having conversations, and seeking out uh, help is the most important first step. And Wish you all the best.
All right. See you.
Have a good day.